Okay, friends, I'm live again. Just let me know whether you can see my screen, whether you can hear me out properly so that I can start my presentation. Kindly just let me know so that we don't waste any more time in this and we can start over here right now. Can you see my screen and can you hear me also in this live video? Please let me know fast so that I can start. Hi Parag, how are you? Okay. Okay, okay. Hi, Harshal. So, without wasting much of time, I'll be starting my presentation for today. So, basically, these are testing times, and these are testing times for every one of us. So, we have to really understand that this too shall pass. Of course, there are many paradigms in life which have to be taken care of when we see at the overall aspect. So I'll be doing this presentation for around an hour or so slightly less than an hour or so. And yes, I'll be taking up your queries once I end my presentation. But of course, definitely there'll be some parts which some of you might have heard to me earlier who have listened to me on any platform. uh, the only thing is that they'll be correlated to today's times. And yes, do keep on sticking till the end because the climax part is always interesting in my presentations and will give you a few guidelines of what we all need to do in coming life. So thank you, World Dentist Federation Forum, for this opportunity to me. Thank you, Team Dads. Thank you, Harshal. Thank you, Ishita. So all of them have been like a family to me now since many years now. So all my presentations always start with thanking the Lord Almighty, who's given me much more than what I deserve. So we are here basically getting the basics of practice right, and testing oneself in testing today's time, so that we can indulge in effective dental practice management. So just before I move any further, I'll just make going to make a cross check, quick fast cross check that whether it is visible and on or not. Okay, so I can see a few comments over there. Yes, okay, okay, okay. I hope we are clear. So yes, okay. Okay, so this is my brief biodata. Many of you might be aware of uh, this. So let's move ahead. So I always lay out a disclaimer first. Before all my presentations, I always say that I am not a practice management guru. I'm just a simple person with some different enabled fundas in life, and my fundas really don't appeal and apply to everyone. But yes, if they have given me success in the period of say 20 years plus in my practice, there is no reason why they shouldn't give you as well. I started my clinic on 1st Jan 2000, 20 years and 3 months and say 12 days back. So I'm sharing them because give they gave success to me. So, but I do request you to apply them at your own risk. So I'll be sharing a few tips today. Don't just try to blatantly write them and copy them. That is not my aim. You can copy my ideas, but the aim is basically to understand the logic and the philosophy behind it, which cannot be copied. So if you are going to follow my ideas without the logic or the philosophy behind it, or my mindset behind it, it'll be a waste. So I always say practice management begins with changes in you first. Whenever you point finger at someone, the other three are pointing at you. So it has to be firstly in you, in your behavior, in your practice, and then of course with the application of smart tips to give you confidence and success. So why I place this slide here? This is one of the very few slides which is there in almost all my presentations wherever I go for practice management lectures. So the only aspect is that now the changes required will be manifold. As I said, those of you who have listened to me earlier will also find some changes in my presentation right now, because this is one aspect which I always believe that changes do start, and the changes start from ourselves. So there will be many changes which have to be brought in our life. So which will be in our life, in our practice, in our working, in our style. So that will be very handy in coming times. you all might have been listening to various speakers in the past few days on various webinars. Of course, I did my first webinar on 25th of March, just to say the second day of the lockdown in the World Dental Association. So it was a different experience altogether on that day. I usually detest social media. I'm not very fond of it. I just use it for my communication or say education purposes. Otherwise, I'm not a very big fan of it. But yes, I'm present on all the mediums as my identity is over there. So you must have been listening to various speakers as I was saying. So we all by now would have understood that the life in general and dentistry in specific is not going to be the same after the COVID-19 mayhem, I'll call it. So the life is not going to be same because we all have to make serious changes. Definitely for those who are doing the journal practice, they'll have to also indulge in, and those who are doing specialty practice, they also too have to bring those changes into their practice. How and what are they? I'll be taking them all in detail at the end. But yes, the kindly try to understand that life will not be similar. As even I am attending many webinars and many say lectures online to various say knowledgeable speakers like Dr. The best one I attended in such a regard was by Dr. Gopi Krishnan 2 days back, from Dr. Gopi from Chennai, and a leading endodontist of India. So but he it was one webinar I was twice, and then had the say urge to watch it the third time as well. So the kind of clarity and the thought process what he laid. So life is going to be very if not difficult, but definitely a demanding one from all of us. So just try to understand that the changes will not be more at the patient end, it will be more at our end. Why do I say that? Because primarily I always believe that let's suppose for example that if any procedure you are charging say 2000 rupees, any procedure charging 2000, and after the COVID say precautions you will be taking for disinfection, sterilization, PPE kit, whatever you can say, your cost of that procedure let's say goes up to 3000. You add every aspect in that, your own protection, your staff's protection, your patient's protection, your say change in working, your change in say different kind of application in your clinic. So all that, let's suppose that you add that portion of cost to that, and still that cost shoots up to 28 to 3000 rupees. Just try to understand, you are doing a procedure for 2000, but after the COVID effect, the coronavirus effect, that cost is going to go to 3000. Of course with the added cost, as is the philosophy that yes, the patient has to pay the added cost. Just remember this part very vividly, that if there is recession, if there is say gloominess in economy all over, the patient will have tough time paying even 2000, leave alone the 3000 part. So that is where you have to understand your finesse and your practice, what you do. So I'll come to those points in the end again. So let's touch upon a few basics. So all of us strive hard on patient retention and accumulation. We want that our patient should also be loyal to us. So what do the patient expect us from us? So they expect that we should be treated as individuals. We are not just OPD numbers, and we have to keep an approach of empathy, not sympathy. So many a times I or even you must have heard this thing from patients. This is the most common or say the chief complaint of the patient, that डॉक्टर ने हमारी बात ढंग से सुनी ही नहीं. The doctor didn't listen to us or our chief complaint properly. If the patient is saying that yes, I have pain and it gets relieved by cold water, you interrupt the patient in between. Okay, I got it. What do you mean by that? Yes, you might be the best. Definitely, if there are 8, 10 guys in your area, you are definitely the best. So, but then if the patient chose you, there must be a reason for that. If the patient chose you, he wants you to listen to that part. So kindly don't take in that sense. So just to try to understand that the patient comes to us uh, for relieving of his chief complaint. So I'm just going to do a cross check again that whether I'm audible and visible in that aspect. Okay, great, great. I can see the comments over here. Okay, fine. So let's move ahead. So then the next part is that the patient always believe that we should be confident or say skill personified. We should be compassionate. We should be say offering them in simple language or a composure to them so that they can feel relieved in our in our environment without any anxiety, without any discomfort. And yes, respect has to be earned. If you give respect, you'll automatically get respect. So, what is the one desired trait in a dentist? I'm not saying asking from the patient point of view. If I ask from the dentist point of view, and believe me or not, this is the same slide which I've been using, but yes, this one aspect will be needed in abundance. Along with patience, this aspect would be needed in abundance. Persistence, persistence, persistence. The need to never give up easily. So remember this part. Along with patience, persistence is one trait which successfully defines a dentist. So I always say it is not a rocket science that you will need a lot of effort to understand. But then it is not very easy also, that it is not like a magical wand also that I'll rotate the magical wand and you'll get the formula and you'll start applying and yes, you will grow in your practice. So definitely not like a syrup also that you will drink and get a formula like Mr. India in the morning and you'll new patients will start walking in. Remember, any accident or say any mishap always has a rosy side. It is always for the good only, which I believe that we all have to understand. Uh, and the whatever limited say days have passed, I'll say still close to 3 weeks have passed, or almost 3 weeks of this COVID-19 lockdown. One thing is pretty clear to me that the standards of dentistry are definitely going to be uplifted. I mentioned it in my blog also. I mentioned it in my say pretty early days at that time on 25th of March WDF seminar also. I strongly believe I'll repeat those words which I used on that day, say 25 days or 20 days back, that the gap between the rich and the poor dentist, although there is no relative term as such, this is a term made up by us only. The gap between the rich and the poor dentist is going to go wider. Those who are following precautions already, the richer dentists will say, who are following all the norms of sterilization, disinfection, of proper say infection control, they are obviously they are going to go further in that aspect and maintain say more safety standards or imply them in their practice so that they give the best to their patient. And the same is say going to land up in their practices. But yes, it will come with a say enhanced reason or say added factor of increased costs. And the poor dentist in those terms which I'll say those who are not very say keen on such procedures are going to find it difficult to survive, because everybody knows it that dentists are at the higher risk. We got a chart in the beginning from New York, uh, who is at the highest risk. And as time passes, as we this knowledge is being spread, it is everywhere on Google. People have no time, and everybody is abundantly available on social media. Everybody is watching news channels these days, so everybody is aware. Or if he or she is not, he'll be aware in the coming days that yes, dentistry is the most risky or one of the most risky professions presently, which has a good chance to transform. Dr. Gopi mentioned 2 days back, whenever the lockdown is completely lifted, uh, the dentist will not start working even after 21 days of that. And I sort of, if not fully, I partially agree with him. Uh, Remember, we have a lot of infection sources, not only the odor, the say humid environment sometimes in the clinic, the use of non-AC environment which has to be followed for a few days. And remember, summers and rainy season are coming up with a lot of humidity. Bombay, I guess already ACs have started. Yes, we are still not running fans in North India, even at say in the second speed till now. But yes, the heat, the summer season followed by the rainy season is coming up, and we'll need to, if we start working, we'll need to work for some time without ACs also. You have to remember those part. So again, it is difficult to work in a clinical scenario for that part. So remember, all these things are going to create a different thing. And always, when I say that, let's come back to this point. When I say the patients expect, say, compassion and empathy from us, they always believe that we should not be, say, underrating the chief complaint of the patient. They need to hear, they need us to hear them out, so that we can, say, be concerned to them. So I always believe in this philosophy. I might be speaking a lot in my lectures. I get on the stage for 1 hour, and sometimes I don't get off for 2 hours, because I love to speak on public platforms, because this is a kind of a, say hard earned talent, which I will say. I used to be a stammerer since my childhood. I couldn't speak even a line. So when I have started speaking on public forums, I feel like a small child, who goes gaga over his newly acquired talent and wishes to overkill it as usual, I'll say. So I don't do that. But otherwise, in my own personal life, I'm a very introvert kind of a person. I don't like to speak much. I always let my, even in my personal life, even in my clinic life, whenever it is the turn of the patient to speak, I always let the patient speak first. I am a lot more observant. I observe the patient's body language. I observe the patient's gait. I observe the hesitation in patient's voice. So I am a lot observant in that part. Of course, my star sign has also got to contribute to that factor a bit. But definitely, the amount of work sometimes I do in a day, in say number of man hours. So sometimes even I am myself surprised at my efficiency. Of course, all thanks to Lord Almighty for that. But yes, colleagues do say that you always have 26 to 27 hours in a day. But if the credit for that after Lord Almighty has to be given, it has to be this one aspect where I conserve a lot of energy. I don't indulge in a lot of mindless gossip. I don't indulge in a lot of behind the backbiting process. But yes, definitely making yourself more observant, watching more, speaking less, listening more. Be a effective listener. Be a good listener. That is the only talent I'll say what you acquire if you are not having it currently, at least in your professional life. Always do it. But that doesn't mean that you do not speak at all in your clinic. In professional life, as I said, I'm a good listener in that in sense. But yes, whenever the need comes, whenever your need comes, you have to indulge in proper IEC activities, information and education with communication. I always say IEC activities. So these are to be observed if we want our business to grow. Of course, at the end of the day, whatever we can say about our noble profession, dentistry is still a business, because there is a balance sheet involved, there is a profit and loss statement involved, and whenever these two things are involved, then there has to be some reason to justify it to not be called as, say, a noble profession, or say a business in that sense. So uh, Aristotle said we all are what we repeatedly do. Excellence is not an act but a habit. So we all have to strive for perfection with selection and achieve success with madness. So I always believe that you should be aiming for that. So I always believe strongly in this concept of me time. So for those who are listening to me, I have been spending my past few days, along with, of course, giving a lot of me time to myself, analyzing where I went wrong. I have written a pretty long article on me time, which should be online in a couple of days. I'll be putting that up on my social media also, on Facebook also, in my groups also. So I would advise. In fact, I have written three articles. All of them are pretty much lengthy, and all of them are pretty close to my heart. The first one is the me time. Uh, what exactly is me time concept, and how does it help us in decision making? So the second one is on colleagues who are, say, young colleagues, young graduates pass out, who actually want to say, uh, open up the clinic or were planning to open up the clinic in the coming months, what all they need to look in for that. It is a detailed study on that, taken a lot of time to develop on it. And the third, very close to again my heart, the pricing and the charging factor. These are the three topics, the at least the second and the third are the ones which I always get to say speak much on my workshops. People always have their maximum queries from these two topics. The beginners have the how to open up the new clinic, and the settled ones or the middle road, I'll say, they have their own pricing and charging. Of course, the other ones also have it. So let's come back to this. I'll be definitely putting up the details for those three articles whenever they are online. Probably in a couple of days from now, they'll be there. So before that, also, I always believe that uh, do take a me time. Take your Sunday off from your clinic if you are not working. Spend some time with yourself. Try to concentrate on say your own self, because I always like to give the say airlines analogy in this, which we say whenever we travel in an aircraft, whenever the instructions are being say passed on to us, there comes a time when if there is a lack of atmospheric pressure, the oxygen mask will fall down. दूसरों को मास्क पहनाने से पहले अपना खुद का मास्क पहने। अगर आप जिंदा रहेंगे कि तो दूसरों को भी बचा लेंगे। So the me time exactly follows that philosophy. If you are losing interest in your profession, in your life, in your spheres, any spheres, other or even profession for that matter, you need to really analyze where are you going wrong. You need to recollect. And I'm not saying the me time is only by say spending some time alone. It can be by engaging in an activity or you love. You'll find all the details in my article. It can be in a non-trivial place, sometimes as the washroom in the morning. People are say known to have a eureka or say wonderful ideas in the washroom, and where some of us spend time, number one by choice, reading newspaper, thinking over some urgent problems in hand, or say by not by choice but by condition, I mean constipation, where they spend eternity over there. So you can do it daily basis, on a weekly basis. I have a good memory. I can afford what how the my how the say passage of time in my week gone by was. So I can reflect upon the things, how things transpired, how could I handled a consultation better, maybe laid out a treatment plan better to a patient. So I can lay out on those aspects very vividly. So I do take off some time on Sunday whenever I'm not traveling for my workshops. So if I'm traveling, I use that time for traveling. Whenever I'm in my train or in my flight, I'm using that time for the purpose of that. That is basically to give rest to your body, also to your mind also, and basically to channelize your energies in the right direction. When you channelize your energy in the right direction, you're bound to get positive results. And me time is a wonderful thing to do that. And believe me or not, a me time is a very very underestimated and underused part of human life. So I came to know about this philosophy pretty much later in my life, but I'm using this alone time, I will call, if not me time. I'm using this alone time ever since I was say conscious in my life, maybe 13, 14 years of age. I'm using this time also. So later on, I came to know that this is known as a me time. So I'll all say need all of you. Why I insisted that you all should read it, because frankly speaking, the lockdown or the present times are your me time going on. So kindly do read those articles whenever they are online. So you'll definitely get newer ideas into that. So I always say, put first things first, learn to prioritize in life. Whenever you learn to prioritize in life, you'll understand what things need to be done first. We all know the four categories of urgent and important, urgent, not important, and not urgent, but important, and not urgent and not important. Believe me or not, the activities which fell in the category of not urgent, not important are the prime say passable time for all of us, in which TV media says your computers, your your social networking sites, your social networking groups, your web series, all those fell in the category of not urgent, not important, but they are the priority right now. So enjoy the break, analyze on this, where you need to, you actually need to understand this part, that you need to plan for your future. Yes, you need to be really aware of the fact that when I say that testing times are going on, you need to understand that practically there will not be a good cash flow in the coming 3 months. Minimum 3 months there would not be a good cash flow. Where do you have to make your arrangements for the cash part? Number one. Number two, which things you are lacking. Say, assess your own self, assess your own clinic, assess, discuss with your wife, with your partner, if in case of females, discuss with your husband. So whatever you say, dwell on the say gravest problems of your life, your clinic, your profession, and say brainstorm over it, indulge in a healthy discussion, and get to a point where you are left with 2 to 3 conclusions in life. So and then you can probably zero down on the possible plan A, plan B, plan C with the options you have in hand. These are the times where you can utilize these things properly. So one of my favorite quotes I wrote in 2015 is, start early, plan well, finish early and well. So what to do in this these times? Again, there will be I'll be dwelling on this in the climax part of this presentation. So there is a very beautiful quote on to learning to say change the way you do the things. One can never change his life unless one changes a thing which he does daily. So there is not a thing that somebody will give you a say magical formula which you'll apply and you'll have changes overnight. But yes, the secret of our success lies in our daily routine only. So unless you can change those daily routines, yes, I know that. We are not following exactly the same routine which we were following before. But trust me, friends, I can give you my own example. I'm almost at least for 6 days a week, I'm following the same routine. I used to get up early in the morning at 5 o'clock, or maybe sometimes when the summer encroached about 4:30 in the morning. So I'm doing that only even right now. So I have not changed my schedule even one bit, because I know myself. My all presentations, as in this today also, my presentation started with, the changes begin with you. So the thing is, knowing yourself is a bigger art than knowing others. I always believe that you should know yourself first. So, and I know myself. If I adopt a habit, it will be very difficult for me to go away or to get rid of that. So I have tried at least 6 days a week. I do not say change my routine in that regard, so that I don't have any problem adjusting later on. So again, that is a personal discretion. I won't be debating on that, how you are doing that or should do that. But yes, I'll be discussing in the on the last 2 slides. Sorry. Okay. Okay. Okay, and there was one we many of us had been piling on our WhatsApp messages that yes, this was a good seminar. I'm just labeling the message as starred, and I will say one fine Sunday or one fine holiday, I'll get up and use these messages to upgrade or update myself. Believe me, those Sundays never arrived. They never come. They never will come. But as luck would have that we were waiting for that one elusive Sunday, and we are having close to 40 Sundays, or maybe more also. You never know. Out of those 40, almost 20 Sundays have passed off. Remember this thing. So, this is the time you need to use, and if you don't use this time, you'll probably regret this time. This free time will never come again in life. Mark my words. So, whatever you can use in these times, do make use of it. If these times can be used in a positive direction, they'll be best for all of us. So I always say we always confuse between marketing and selling. What is the difference between the two terms? Remember, I always quote one example, and this: suppose the patient comes to you with a pain in 3/6. by the look of it, you know that it is a root canal case. Of course, I'm not telling you to bypass the say radiological norms. Always take a preoperative X-ray, even if the case seems a short case of a root canal. So don't do. Let's skip those things on medical history, radiological, all those bypasses. Let's keep all those things at a side. The patient comes to you, and you, by the look of it, judge that 3/6 is a case of a straightforward root canal. Suddenly, your focus shifts to patient's right side, missing 4546. The basic human attitude or the basic approach to this is man mein laddu phoota, as we see in the Cadbury laddu ad. So that is the greed is the basic human nature, and that is perfectly normal for such a situation. I always say that. So the basic instinct is that we'll try to say open up the root canal in 3/6 and then start our convincing part for an implant or a bridge for the 4546. If we're indulging in selling, we'll do that. If we're indulging in marketing, we will never do that. I always say treat the patient's immediate problem with the three E's: efficaciously, efficiently, and effectively. Efficaciously, efficiently, and effectively. Treat the problem with three E's and let the patient be pulled back to you, because the aim is profit through patient's satisfaction. It is going to be a long term thing, and we always would desire a repeat visit of the patient so that the patient becomes ours forever. So that is the aim of marketing. If you're interested only in sales volume, you'll be say doing a car salesman like job and pushing from one job to another job. But then if I mention about say marketing part, if I mention about this part, your duty does not end once you complete the 3/6. You always have to indulge in the other I&E. The first and I&E I mentioned was the income and the expenditure. The other I&E is information and education. At the end of your say job for 3/6, once you've done it with the three E's as I mentioned, your duty is to bring it to patients kind notice about the missing 4546 and the problems they associated with that. And remember, your options start from the highest option. So it is a Supreme Court ruling in say 2007-8 also. Every patient, irrespective of his social status, has to be given a choice of an internationally acceptable norm, whether the doctor is offering it or not. If I put it in simple words, if there is a missing tooth, the number one treatment possible or say suggestible is an implant, whether you are doing it or not, whether the patient can afford it or not. So the options start from there. Remember, the options won't start from a bridge just because you are not doing implants, or maybe they start from a RPD because the patient can't seemingly afford it. So remember to separate between the two. I always believe that that is the reason I'm speaking on these three topics altogether: practice management, medical legal, ethics, consent part, and finances. I always believe that these three are interconnected with each other, because practice management, at the end of the day, as I mentioned earlier, is a business, and any business comes with a zeal to earn more, ending up with more profit by earning more. And sometimes, in a zeal to do so, we cross on to the wrong side of the law. That is where the role of medical legal ethics comes in, which tells us not to say tread those dangerous paths. And okay, once you earn it in a legal way and you have a good amount, if you don't know how to earn from that money, your all earning would be going waste. So remember, this has to be a part of it. So I'm just going to do a cross check once again on the slides part, whether are there any comments or whether is there any disruption. Okay, I hope yes. Okay, okay, okay. Fine. Okay, let's move it. So remember, if we resort to a certain activity like say a car salesman activity, remember we are a noble profession. You need not go to those levels to gain patients. We ought to maintain certain amount of dignity. So that brings me to the most important, say, pressing issue or the desire: understanding the patient's needs and wants. Remember, whatever testing times we are having, whatever situations we are having, at the end of this coronavirus episode or mayhem in India or all over world, the recession might be there, but dentists will never go out of work. Why would I say that? Because the needs are never going to diminish. The tooth pain, the periodontal problems, these things are going to happen. The only things that will diminish are the wants, the zirconias, the veneers, the laminates. I'm not saying they will definitely do that, but yes, they'll be limited in a average clinic. In an average clinic, what used to be our bread and butter will be definitely going in. So we have to remember that certain aspects are to be taken up very, as I mentioned about the cost part. If you are doing a root canal for say 1,000 or 1,500 or 2,000 rupees, remember with the addition of infection control procedures, extra precautions, PPE kits, all those what lie in the future of dentistry post, we always say AD and BC for Christ. Taking this lecture today on Easter Day, so auspicious Easter Day. Luckily or unluckily, I'll say luckily only, all my presentations have been on some auspicious day or not. They were not planned like that, but they ended up being on the auspicious day. So today is again an auspicious day. So I always believe that yes, these things have to be taken into account. Those costs, and those costs will not continue to remain at 1,000, 1,500 or 2,000 rupees. So yes, the people choices may vary with time, with the say options given to them, but the basic difference is to be understood that the needs will continue to be there. We are not going to go out of work, but the only thing is this is a deadly disease. And see, you might be seeing all the say all over the net, all over the social WhatsApp groups, the corona consent form is floating. Believe me, those who are taking consent, they are not finding it hard to accept. But for those who are not taking any kind of consent, what about them? So there we have to understand the difference between this. So the basic information starts from this part. I always advise colleagues to add two columns in their record keeping if they're not doing that. If you're not doing that, this is a good time to reflect upon to start. Very soon, I'm working on it. Very soon, maybe in the next, because I'm clearing all my publication backlog. So very soon, maybe in the next week or 10 days, another of my article would be there on medical or dental record keeping for the lay dentist, for the dentist. My all presentations are always directed to the small to the medium sized dentist. With no disrespect, I always say I target those dentists who believe that yes, I am also one of them only. So I don't target the super rich dentists. No disrespect, as I said in my presentation, I target the middle class dentists, and I believe they are 90% in India. So I target them. So if you are not doing record keeping, believe me, as a speaking as a medical legal expert, I'll always say that record keeping is only or sometimes a big savior. Apart from that, let's again skip those parts for some other day. Uh, what I always believe is that you have to add two columns in your record keeping apart from the usual ones. Number one, patient source of referral. Where did they get your info from? The second column, patient socio-economic background. These two factors make you understand a lot of say things about patient, and they tell you how much they value their health, their dental health especially more. So and it tells you what sets off their psyche to choose you, how do they trust or whom do they trust. And remember, in all the 4 points I've listed or the two points I've mentioned, there was not a mention of the pricing part. And we believe, we strongly believe rather, that the patient comes to us for pricing only. That is where we are say erring on this part. Many colleagues would beg to disagree with me, but I have no suggestions because I laid out a disclaimer at the start. I use my own fundas, but do apply them at your own risk. I will do and suggest only what has brought me success in these 20 plus years, and I dictate those things only. None of my say presentation you will find in any book, because I don't say I'm not speaking from book. I speak from my own life's experiences. So remember, pricing is definitely one of the three criteria patient might choose, but this is not the only criteria. More on that in the pricing section. So always insist on feedback. It is the breakfast of champions, as Ken Blanchard has said. So insist in feedback. It can come from any quarters, from your staff, from your associate, from your assistant, from whosoever, and of course from the patient. And learn to develop a sixth, third eye. I always say Shivji ka tisra netra. I always say so. Learn to have a sixth sense kind of a thing. Learn to judge between a right feedback and a wrong feedback. Of course, sometimes we always say that we don't believe in feedbacks whatever the patients are giving us, or maybe our staff giving is giving us. You have to trust to certain level that you have to imply certain things in your practice, in your life, which are say sure to bring a change in you. As I said in my earlier slide also, you don't have to change everything, or you have to imply new things. You have to bring a change in only things you are doing in your daily routine. So I always say take a feedback, value it, and if you feel it that it is surely on the right side, implement it. Sometimes even say fifth past assistant or say your helper or staff member can give you such an advice which even biggies can't accomplish. So I always say, especially for beginners, the key is the first 10 happy patients in a clinic, happy or successfully done patients in the clinic. एंड ऑलवेज से 10 से 20, 20 से 50, 50 से 100 की जर्नी काफ़ी टफ होती है फॉर अ बिगनर और फॉर अ मिडिल रोड प्रैक्टिशनर. Once you reach 100 satisfied or happy patients, the time from 100 to 200, 200 to 500, and 500 to 1000 does not take much of time. I always believe that जब आपके 1000 हैप्पी सक्सेसफुल पेशेंट्स हो गए, मान के चलिए कि आपकी पेंशन लग गई. So obviously that chain is going to grow further and further in life. Again, the precondition is that you do not change your work ethics. And I am a big fan of Akshay Kumar in this. He has the same amount of time what all of us have in life. And he always says while he's shooting, his movie schedule is usually of 40 days, and he wraps up the schedule in 34, 35 days. And his answer is in one line: can't we shoot even 4 minutes of movie in a day? 4 or 4.5 minutes of movie in a day? In the whole 8 hour shift, can't we shoot even 4 minutes of movie? If we can do that, the movie would be automatically wrapped in 35 days only, flat. So that is the kind of work ethics he has. And of course, he's a Virgo like me, so that was on the lighter side. So I always believe that after a few years of good practice, money becomes a byproduct. You really don't have to worry about this part. Again, these are the testing times, but yes, those who have a good loyal patient base, they will not have any problem in adjusting back to their routines of practice. Yes, the patients will be skeptical in coming times. Yes, you also have to bring some changes, noticeable changes. And everybody knows, if everybody, as I said, is on social media or news these days, that is the not urgent and the not important activities are the biggest say time killers in today's time, in these at least 40 days out of his 20-year past, I'll say. So they know what a PPE kit means. They know what quarantine means. Everybody know, people couldn't who pronounce quarantine, now they know the meaning of the same. They know the full form of PPE also. So they know what costing it is going to come. And at this point of time, I'll mention, don't get frightened by pre-booking the PPE kits. I'll come to that in the last part. Let's leave that point here. Sorry to bring it up in between. So they know it that the doctors will be needing PPE kits in clinic, especially the dentist, because we are at the highest risk level. So they understand or they appreciate, those dentists, those patients will appreciate yes, the cost is going to go up only. But yes, as I said, your costs are going to go up, but the money is not, is in say good flourishing cycle presently. So the, say, colleagues have to understand this part, that that time will not come that they'll open up the clinic and on the second day onwards they'll start having an OPD of 10,000 per day. That is not going to happen. We all will have to have some gestation time again, and this will apply to almost all. But yes, those who have a good, loyal, satisfied patient base, as I mentioned over here, that will not take time. So you keep on doing the good work, you keep on following the latest protocols and norms, because people will ask you, doctor, why are you not wearing this kit? Doctor, why are you not using gloves? Why are you using sanitizer? Why are you not changing the shoes? All these things, all those who are not doing it, the patient will start questioning now. Remember, more of awareness is happening. So again, go back to the first slide, the changes will begin with you first. So remember, those patients will have to be answered, and if you don't bring changes in your time, you will be considered as a laggard in your profession, that you are not updating and upgrading with time, with need. And of course, nobody would want to risk his or her health with you. So sometimes we are more interested in proceedings than the process itself. So some of you might be waiting for the tips. I always try to give the whole process rather than the, say, small, just the tips level answers. I always try to give the whole process, so that you end up with the whole concept and pick and choose according to what your priorities in your life are. So, in the last of all, I always say, trust God, because He's the one who's brought these changes, and He's the one who's responsible for ultimately feeding us. So, you can't go ahead or move ahead without trusting Him. So, that brings me to the vital aspect of this presentation, the Pareto's principle. This is one principle most of you would be aware of. Still, I'll be taking up that in short form. Uh, I have been, say, an ardent fan of Pareto principle ever since I came to know about it in 2007-8 via my MBAs only. So it broadly states, let's suppose you are treating 100 patients in a day, 100 patients in a month, and earning 1 lakh rupees. So let's just to presume I have taken round figures. So via Pareto principle, you will see, if you say check out your records or details of the patients giving you income, you'll find that 20% of 20 out of those 100 patients would have paid you 80,000 rupees, and the remaining patients, the remaining 80 patients that you treated, contributed only 20,000 from that 1 lakh monthly income. Just try to understand, 80% of your income is coming from 20% of your patients, and the rest 20% coming from 80% of your patients. So identify those 20% potential candidates. When I say that line, identify those 20%, the first question comes is, sir, patient अपने माथे के ऊपर चिट लगा के थोड़ा आएगा. I am a 20 category patient, kindly milk me. So this is for you. Go back to your the slide of target audience, the patient's source of referral. Number one. Number two, talk out with the patient. Listen more to him. All this I have covered before. So listen more to him. The more you listen to him, the more you will definitely arrive at a solution. So I always believe that sometimes you have to be alert and awake in your practice. So again, continuing with the Pareto principle, 80% of your profits from 20% of customers or patients, and 80% complaints also from 20% of your patients. So the value is that basically you have to focus on 20% that really matters, and correlating it these with the current times or the coming times. Remember, you have to follow this principle ardently. You will have to. Many of my colleagues in my area, or even in various states where I go for my lectures, they are very fond of flaunting their OPD. Sir, I have a OPD of 45, I have a OPD of 50, I have a OPD of 60. Believe me, I have an OPD of average 11 to 15. I filter out my patients every now and then. A dentist who is working 8 hours a day cannot have more than 8 patients, sometimes even less. So you have to understand, what do you want, quality or quantity. I would happily, I would happily love to exchange my OPD with those who are doing 50 consultations in the day. I'll be happy to do 50 consultations at 200 rupees, carrying home 10,000 per day without doing anything, just sitting on my table, listening to the patient and prescribing medicine, which is not actually possible in dentistry. So if somebody is saying I have an OPD of 50, he's not treating those 50. We have to understand that part. So in coming times, you have to pick and choose those 20 which really matter, which are going to give you 80 results. And how will you do that? The more you talk with the patient, the more you assess where the patient came from, the more you understand his needs and wants, connect with his psyche. The needs and wants would always be connected first thing. That will be the prime requisite. You understand. Once you understand the needs and the wants, then only you can claim it effectively. We are probably so bogged down in our life that while treating, we don't have even time to take, say, give proper instruction at the end of the treatment. Sometimes we direct our assistant to do so because our attention is towards those patients, 5 patients who are already there in the waiting. I work in a very reverse manner. I started this system in 2007. People laughed at me and my town. They said, why I did this was because my daughter was born in March 2007. So, along with her, say, birth, she brought me good luck. My OPD, say, zoomed up to 5 to 6 times what I was doing. Suddenly, I was finding it difficult to handle. At the peak time of the clinic in the morning and in the evening, say 5, 6 patients were sitting, but when I was able to treat maximum one or maximum two, and most of them say used to walk away. Luckily, as I said, I am lucky to have the sixth sense in some matters, not in all, or the third eye in that part. Again, in some matters, so I'm lucky, blessed by Lord Almighty to have that. So I judged that problem quickly. I knew that the problem was at my end, so I accepted it happily and overcame this say problem by setting up appointment system. I was ridiculed and laughed at by my friends who were there in my town. The only line they said were, "Tu Ludhiana walon ko." I practice in Ludhiana, Punjab, basically the center of Punjab, or they say industrial capital of Punjab. Otherwise, the capital is Chandigarh. So they said, "तू लुधियाना वालों को practice में time पे लाने को appointment से बुलाएगा? Do you think it is possible?" But yes, it was tough in the beginning, but gradually everyone adjusted, and now it is one of my key points of the clinic. Still, 2 patients randomly, I always say, 2 patients randomly in a week always say, who especially those who are coming from far off, we come to you for 2 reasons. You don't make us wait, and number two, you have all our details with you. Record keeping. You might find it very trivial. A zero waiting time and a record keeping can be a, say, seller in your practice. Yes, internal marketing things are bigger seller than the external marketing things. External marketing things, they say, they diminish once the patient steps inside the clinic. What do Shah Rukh Khan, Amir Khan, Salman Khan, any Khans, or for that matter Hrithik or Akshay, or any star do? They just entice the crowd based on their face value to the cinema hall multiplex on a Friday, Saturday, Sunday. Of course, आजकल के टाइम में पिक्चर बुरी हो तो सैटरडे को भी पड़ जाती है, but let's talk in a conventional way. So they can pull in the crowd only on a Friday, Saturday, and a Sunday. Monday onwards, the content does the talking. If the picture is good in content, the film is good in content, then only it will run. Otherwise, it is going to flop miserably. The same way, external marketing might have many benefits. Once the patient steps in, the external marketing ceases to function. Their internal marketing takes over. What is the clinic layout? How are your curtains? Does your corner have dust in your clinic? How are your blinds? How neat, how much neat and clean your setup is? How much say attention is being paid to patients' details? How much say what kind of working style is there? How much patients are comfortable with you in your practice? All these factors are noticed by the patient, and if they find you good, then only they will turn back or say come for a repeat visit, or they will never turn back, or you will say the consultation didn't mature. People will always blame something on the wrong side. मैंने तो किया था, पेशेंट को समझाया था, वो समझा ही नहीं. Maybe he got pissed off by some internal marketing factor कि इनमें तो सफाई तो है नहीं इतनी क्लिनिक के अंदर जितनी ये लोग बोलते हैं, ऐड तो इतनी करते हैं, they are marketing so much, but there no, is not much of cleanliness. So remember, nobody is coming here to risk his or her health with you. Now coming back to those times in today, in today or say upcoming testing times, COVID times, I follow this routine as I said already that I always keep a gap of 15 minutes in my patients. Rarely you will find a patient sitting in my waiting unless he bumps up, say a new checkup or any problem or any complaint patient who is new to my practice is there. Otherwise, I hardly keep any patients in my waiting. This is was by choice. But in coming times, all of you will not have any choice in that matter. You'll have to stick to this matter. You can't afford to have a rush of patients in your practice. You have to treat less, going by the Pareto principle, so that you don't risk the cross contamination. Even Wuhan reported a few cases 2 days back. Remember, they have say declared already in March, in the month of beginning of March, or they say mid of March, that Wuhan is free. And as per the data, they were saying earlier, Chinese, you can't trust Chinese people in that matter. They were saying only 6,000 or 5,000 deaths. Now, a detailed report has come that there were 34,000 deaths or 42,000 deaths. Not sure, but this is the news that came up today. So they have declared Wuhan totally free, but still there are cases even reported yesterday as well. So we cannot be even sure even after the lockdown is lifted, what is going to be the status. So the precautions have to be followed. So you can't keep on working like you were earlier. Believe me, lockdown might have affected many people's lives. Luckily or unluckily, again I will say it has not affected me much because my residence is in my clinic. My clinic is in my residence only. So I don't have much say changes to adapt to in my practice. The only thing is that people who were not there because of compulsions, the kids went to school, the wife went to job, mom went to say a nearby physiotherapy or say gurudwara. So they are right now with me in these times. So I'm getting to see them more often than I used to see them earlier. So again, I'm working with these things which are being promoted these days. Many of these things. So I'm not finding all these hard to absorb because luckily or unluckily they are already part of my life. But yes, now you will also have to follow these principles in upcoming times. So remember, whatever things you do in the day, 20% really matter, and these 20% really will produce 80% of your results. So the first thing you have to do is learn to identify and focus on those things. This is where the importance of me time comes. When you strictly analyze your life, what is going to happen in coming times. So the 20% cause will always give the 80% effect. Remember this principle. This is going to be a part of your life from now on. So uh, mark those 20% of the patients who are going to give you 80% income as your star or ambassador patients. They'll be like a coveted trophy for any clinic. So whenever your OPD goes down, say as a say pride raising measure, I'll say self-esteem, raising your self-esteem, call them for a quick checkup, of course free of cost, not charging from anything. More than anything else, it raises your own self-esteem that you have indulged in kind of a thing. Because remember, as soon as the lockdown is lifted, uh, probably whenever we start working, it will be nearly 2 months uh, properly when we start working in a good manner, or even more than that. So many of us will even feel that शायद ये काम हमने कभी जिंदगी में किया ही नहीं है. That feeling will be there for our first few patients. Of course, this is not a talent or a thing which will be forgotten, but yes, you'll find some hesitation, some say shirking of your hand in a way. You'll find it a little bit say odd, because the human mind or the human body gets trained to a particular task, and at present we are trained to laziness, all of us, most of us. So nothing wrong in that. This is the we used to say survival of the fittest. Now it is the survival of the laziest. So there will be we all have a means in dentistry. There will be a time in our life when we will say tell our grandkids that we say played safe by doing nothing. There will be time in those things. So there are a few things whenever we say what are the causes of stress in dental office. Again, these are the factors you have to check. As I said, dwell upon your gravest concerns, personal life, professional life, and usually stress in dental office or stress in dental clinic is one of them. So the probable reasons most likely are lack of sufficient staff. We overbook our appointments. As I mentioned before, as per 80/20, you have to limit those. We all are fond of multitasking. I see this in my family also these days, along with their laptop, along with their tablets, along with their mobile phones in hand. They're having lunch or they're doing one activity. They're playing carom also, and they're having a mobile in hand. So they get scolded from me every now and then for this thing. But yes, multitasking has become a part of all of our lives. But yes, this is one trait I do not say I'm very fond of. So I don't so kindly limit yourself to a particular task. Focus is the need of the hour. So the more you focus on your self, your task on hand, the more you'll be able to perform better. So I again have a say quote for that. Let the task of recreation rip if it's itself is causing you stress. So if something to make you stress free is causing you hypertension, so that task should be resting in peace itself. So remember this line always. So you all set a few targets for yourself, and whenever you say if you are not able to achieve even 50% of that, so that means either you were too over realistic in that pattern, or you don't know yourself or your abilities. So that only means, as I said before also, knowing yourself is a bigger art than knowing others. And this thing has a direct correlation to your working also in practice. As I said, in coming times, you will have to apply that trait in your practice. Otherwise, you cannot focus on your patient in hand. Five patients are sitting, five patients with PPE kits, or say shoes changed, or getting disinfected, or getting a travel history, or getting a signing a consent form. Not be practically possible. So you have to focus on in one inside the operatory, or maybe one outside the operatory. So for that, you have to slot and work in your appointments in such a way that you really focus on limited amount of patients. And when you do limited amount of patients, treat less, charge more. That should be the mantra, and that would be the mantra. And believe me, guys, the colleagues who have been giving the reason of the patient does not pay, that'll all come down to farce. Either they'll risk their own life, their family's life. Remember, a dentist's life is not his life. Once you start working in your clinic, and God forbid, if you have a cross contamination in your practice, you're going to infect five other persons of your family, and those five are going to infect another five of your family. So that is the percentage of infection. One person infects about 4.2. I was seeing the data today. If the lockdown was not, say, inserted on 24th of March, as done by our PM, Shri Modi ji, so by April 15, the number of infected cases would have been 8.2 lakh. Can you just imagine that figure? It didn't take long. By 31st March, of course, whatever happened in Nizamuddin was unfortunate. By 31st March, we had not touched even the first 1,000. We were about 927 something, or 890 something cases, in the range of 900. They were there on 31st March, and that included some infected from the Jamaat factor also, some which were not in light at that time. But remember, the first 1,000 was reached in about 2 months. The first case came in India on, I think, around 30th Jan. Almost 2 months it took to say reach the first 1,000. And as I talk, it is April, and we are almost touching 9,000. So you can imagine. So you have to understand, you cannot afford those habits what you are doing. You'll be requiring a bigger change in you, not as a practice manager, in your working style. So your patient should be having ideally zero waiting time, or at the most 5 to 7 minutes. I work with a similar manner. I told you, I always keep a gap of 15 minutes in my patients, and I'm doing it since 2007, and it is not difficult. I took around 3 to 6 months to adjust, but those were different times. People were not habitual of coming to appointment. Today's time, people value time more than that. Today, time is money, time is gold for them. So they will value more. So remember, if you give them a zero waiting time or say minimum waiting time, that will be appreciated. That can be one of the bigger sellers, and that is a part of an internal marketing tool. As I said, keep a gap of 15 minutes. Again, that'll come with a planning and knowledge and confidence to finish your work on time. And that is where I always believe your receptionist should not give the appointment. Again, there will be many eyebrows raised over this, but this thing I have been following since many years now successfully. Why I say that? There are two angles in this. Number one, I know which patient is of more importance. Speaking from Pareto principle point of view, I will like to schedule that patient in my peak time when I am the freshest or when I want to work with the maximum efficiency. I will treat that patient in that slot. Number one. Number two, the receptionist will give a stereotype appointment. Maybe a procedure is requiring 15 minutes. The slot given is 11 to 12. You done at 11:15 or 11:20. What are you going to do for next 40 minutes? Yes, a break is always desirable, but the break double the time of your work or four times your work is never desirable. So remember, you have to schedule the appointments, and the appointments have not to be stereotyped. That 30 minutes for each slot, 15 minutes for each, or 1 hour for each slot. In my clinic, sometimes I have three patients in the day, especially when I'm having longer patients or NRI patients. They're having. I work on one patient in the morning schedule from 9 to 1 or 9 to 2. I work on one patient only at that time. All the remaining appointments for that schedule are cancelled. In the evening, sometimes I have two patients. I work from 4 to 6 or from 6 to 8 on another. So total patients I did in the day was three. But the hours I worked on maybe 8.5 to 9 hours. So number of hours matters to me. Number of patients does not. Because and again, this aspect will also need to be copied in coming times. You'll need to finish more in one sitting for one patient rather than doing, because every time you are using a PPE kit, that will work out to be more costly for you. If you think on those lines, yes, we are not still sure that whether we'll be requiring that, but as of now, if we are high on the contamination list, we'll be requiring PPE kits disposable for every patient. What does that mean? You have to treat less so that you have to change less, so that your costs are decreased. I always say dictate from the financial point of view. I'm the son of a banker. I've learned finance from him. Of course, I have an MBA finance also. But yes, I think from those angles. Profitability angle. Working on more length on one patient will be, say, cheap in terms of cost, rather than working on 10 patients in that schedule of 4 to 5 hours in morning or evening. Think about it, what I'm saying. So uh, so I always say trust is like finding a needle in haystack for those who don't believe it even exists. So whether you trust me or not, the onus lies on you. So the two most common queries get in every session is that my patients are not on time and they bargain too much always. What is the reason for this? I always say that we have to say distinguish between these two things. What are they? The point is that why you are following a certain system in your practice. Why are you supposing that the patient is going to assume or presume the way you are working? That is the thing I always insist. How do you assume or presume? And if you are going to charge a certain cost in your practice, so what you will believe in that? How does the patient know how much he has to pay, or say how much he is going to be charged in that part? So this is for you to realize that you have to convey it. And where does all this start? This starts from the first consultation. I always believe that the first consultation is very important part of any dentist's life. So let me explain all this in say simple language to you. So you want to follow it or not, it's a personal choice. But yes, I always would insist that the things which are there in our practice have start, or say the bane of most of the problems is the first consultation only. Because whenever the patient comes to us in our practice, the first aim is to immediately start something. Even if we are busy, get something started on that patient. get a booking amount, I'll in apostrophe booking amount, say in hashtag, and then expect the patient to come back. So remember, you have to understand this part, that the patient, so imagine yourself in a scenario. You went to an exhibition, you got a very good enticing say holiday or a vacation offer, and you paid a booking amount upfront. The package was for, let's say, 50,000 rupees. You upfront paid around 2,000 only as the booking amount. So you really appreciated that. Wow, we got a good deal. You came back, slept over it, talked another next day to your colleagues or friends that you got a good deal. But then that is the difference. You got a good deal. The colleague will tell you that I got it for this. Suddenly, your say mind horses get in motion, and you start say acting on that part. So the suddenly you realize, or this thing dawns upon you, that, oh, maybe I got a bad deal, or I got a rough deal. So what does it mean? You will like to forego that 2,000 rupees, rather than say get your remaining 48,000 entrapped in that deal, when you are clear that that deal is not exactly as enticing and lucrative as it first appeared to you. Similarly, if you pre-book a patient by a booking amount, how can you be sure that the patient will be coming to you for repeat visits? So that is the reason I always insist that kindly indulge in first consultation. And as I said, all things begin from here. Understand patient's needs and wants, watch more, speak less, let the patient convey the first complaint. All those slides which I've taken up in the beginning. So, how will they say be appearing to you? They all start from here. So, the first consultation is basically meant to say, many times we wonder that even after explaining all the pros and cons of the patient and the payment options initially, the patient misbehave at the time of final payment and resort to unethical bargaining. Where does the problem lie? The problem lies in the, say, even sometime, even after detailing that you work on appointment basis, they don't come on time. So consider these patients as your best teachers, and at this juncture, remember again a me time consultation with yourself, that where you committed a fault, where things went wrong. As I told you, dwell on the week gone by. Try to understand where you faltered, where you faltered. These all the things. These are will be the things which you will always say like to reassess. Maybe you could have approached that consultation in a different manner. Maybe you could have talked out to the patient in a different manner. So basically, it sends out three messages to the patient: that you are not overconfident, you convey the charges to the patient, and the mentality also is clear to you whether that patient falls in 80/20 category or any else category. So, as I was saying, what to do exactly in that first consultation? What will be the say norm on that? So, let them know your system of working, your timings, your routine preferences, and your expectations from the patient. Again, this will come. Uh, my first consultation part begins sometimes in the second setting. The first setting, we talk out the chief complaint, write the medicine, or write for the investigations, and then if it is a long, I'm just giving an example for a long case. So I give the patient time after maybe 2 to 3 days, make a treatment plan first in my head, formulate it over there, write it down. Remember, writing down is very important. Once you write it down, your brain or your subconscious mind starts working over it, and write the treatment plan and sleep over it. Once you sleep over the treatment plan, your subconscious mind will, in the morning, sometimes early in the morning, will give you fresh ideas. Yes, you might approach this task in a different manner. Again, that will boil down to the fact whether how much are you in love with your profession, dentistry in this case. So remember, if you are in love with your profession, you made a treatment plan, formulated it first in the head, wrote it down, and slept over it. Your mind will give you ideas. And once you are ready with plan A, plan B, plan C, if needed, otherwise, you should always have plan A and plan B in hand. And remember, it is not only you are doing the homework, the patient will automatically come armed with his hidden colleague. And who is that hidden colleague? Dr. Google. Every patient is well informed these days. Believe me or not, they all come armed. I'll just give you a very small example. The patient came in for a missing tooth. You say checked up the patient and gave the consultation for later time. So, or maybe the same day you had time, you indulge in consultation. Said missing area, okay, and you're not doing any implants, and you don't know even about the Supreme Court ruling, which I mentioned some time back in this presentation only. So you say, okay, we have options. You can go in for a metallic bridge or a PFM bridge, or if you can afford, or a zirconia bridge. Uh, the Sometimes the patient say, doctor, implant nahi kar sakte. Remember, if you're not doing implants, you are responsible to some ahs and uhs in your slur in your voice, and yes, हाँ कर सकते हैं, बिल्कुल कर सकते हैं, करेंगे करेंगे, कोई नहीं, वो कर देते हैं आपके. The patient fatigue से judges you that where are you faltering. Maybe you are not confident of your skills, or maybe you are not doing it yourself or outsourcing it. Nothing wrong in outsourcing. You can't be say jack of all or master of all. You have to understand that, but your options should begin from there. Remember, if you have slept over the treatment plan, the patient has also come armed with Dr. Google, as I said earlier. So if you, okay, let's assume this part aside. So the patient, you have made a treatment plan and you're ready to do your first consultation, and at that stage of time, once you convey the treatment plan, if the patient says okay fine, we'll go ahead, then you convey your system of working, your timings, your routine, your preferences to come on time. And you will convey, whenever I'm doing a say demonstration, I give a demo of the treatment plan. Let's suppose you are charging say 1000 rupees for an extraction. Let's suppose 2000 for a root canal. In the first sitting you do an extraction, you will charge 1500. Next sitting you're doing a root canal, you will charge 2500. What do you mean by this? When you convey the treatment plan, you have to convey the payment schedule along with as well. Remember, the patient is not interested in the breakover charges. How much this, how much this. If you say the total treatment plan is 50,000, and you give a breakup, and you know which day you are doing which procedure, the treatment plan should be such detailed, because I make them myself and I expect you also to do that. So when you do that, and yes, that understanding has to come again with knowing yourself, knowing your ability to finish that task, and then knowing the aspect how much is the turnover rate of your lab. You give a crown today to them. Let's suppose you're getting the work from the local lab only. You're giving the crown today to them, and what time are they, say, what is the downtime for the patient to get the final crown? You have to understand that and plan it accordingly, and then you have to sync in accordingly with the your patient schedule also. Then you have to sync in those things with your Pareto's principle also, that doing the patient in your peak time. So this is the difference. When you apply all these three concepts in your practice, you might find it difficult to do so, but remember, this is not as difficult as you might be listening. Again, every system requires a routine, or a say every process requires a system to be followed, and the system creation takes time. And when you create a system, everything comes naturally. You don't have to plan it. It becomes a part of your body, it becomes a part of your schedule and your routine in real true sense. Remember this part. So certain things are inbuilt in your system, I will say. They, as I say, you become a system enabled administrator from God himself, in that matter, that you are inborn with those talents. This is nothing but practicing of those traits over a period of years, again and again, again and again, so that they become part of your routine. This is what experience and creativity in your own profession is all about. So when you convey it, suppose you are charging 1000 and you charge 1500 at first step. So you're charging 2000 for a root canal, just assume, and you're charging 2500 at next step. You have made a treatment plan in such a way that your treatments are your payments are going to finish at the third last sitting. Let's suppose a patient misses an appointment at, maybe you have total 10 sitting, the patient misses a payment at third in spite of conveying. It's okay, no problem in that. As a human being, some amount of empathy should be allowed. So tell them very politely that if you missed, no issues in that, but the next time you're not going to pay me the third. You're going, because we are going to give you the fourth sitting, you are going to pay me the third and the fourth sitting together. Remember, it is your own money, because if you're working in that ways, you have accepted a situation. Why I believe that this thing has to go, because the patient has to understand your psyche, your mindset, the way you are working. If you are putting in your whole effort, the patient has to understand those parts and act accordingly. So the you have to pay me for the third and the fourth sitting on the fourth sitting. Fine. And if the patient plays a harakiri again, warn him second time again. You do it on the fifth time and tell him if you are not going to continue treatment ahead, if you are not going to cooperate. The second problem sometimes we face in this situation is that the patient is, you know that the sitting is of 1 hour, it's coming 30 minutes late, 40 minutes late. I usually tell the patient that your whole treatment plan will be compromised if you don't act in a manner. If you want the best from me, you will have to do as I want. Remember, many colleagues complain to me, sir patient इतना मानता ही नहीं है बॉस, इतनी इतनी बात मानता ही नहीं है बात हमारी. I always reply them, बॉस क्लिनिक आपका, रूल्स आपके, आप वहां के बॉस. Who's the patient to guide you in your treatment plan? Who's the patient to guide you in your, say, schedule? If you are the boss, if you are sure of your ability, believe in yourself. If you are sure of your ability, if you know that you can do it, you should have the courage to do it also. And you should not be shy of demanding your own money. If you have worked something, invested something, it is your money. So I always believe that all those things can be put to rest. For long cases, as I mentioned, if it is a 50,000 or a 1 lakh case, my treatment sometimes does not begin till the fourth or the fifth sitting. This is the first consultation. Then it is followed by, say, the informed consent part. Firstly verbal and then the written part. And once, the only logic behind one is a single point, that me and my patient should be on the same page. If both of us are on the same page, only then I'll be starting the treatment. So let them know the charges they'll be undertaking in the treatment, along with the schedule and the timing part. So again, as I said, you have to be confident of your skills, knowing yourself, knowing your lab, what is the downtime, and accordingly you have to charter out or make a treatment plan accordingly. So bottom line is basically how you work and what your skills are to your patient. That is the one thing, bottom line, what we desire. If you conveyed everything, there is no room for assumption or presumption. Why will those two chief complaints happen? Not coming on time and not paying on time. So understand those parts. So chalking the schedule again involves cooperation by the patient, dedication by dentist, and as I said, mental planning and success, formulation first in your head, then on paper, and finally in actuality. Let and always I advise sleep over the treatment plan. So make patients aware of all the pros and cons of the treatment, informed consent part. So take their verbal consent and tell them they have to sign a written one. So I took up a medical legal session in the Underdog Dentist Squad 3 days back. So you can check out on those session in the Underdog Dentist Squad by Dr. Girish Likhiani. So you'll get a good amount of insight. It is there on my Facebook wall also. It was a 2 again, like as I started this session with a timeline, I'll be say speaking for 1 hour. I'm already 1.5 hours into the session, and even that was started as a 1 hour session and ended up being a 2 hour 5 minute session. So if you're not taking consent part, this is the time to design your consent form. I guided in that whatever you see on the net is the body of the consent form. The top and the bottom has to be customized. More on that, you can check out my video on my wall or in the Underdog Dentist Squad. You'll get to know, because if I go on speaking on that part, it'll take too long over here. So kindly see to it that if you are not taking consent, do start it. If you are going to take the COVID consent, the other consents have to follow. Imagine this is a golden opportunity for you in coming times. In coming times, why I say that? Because in the garb of a COVID-19, make other consent forms mandatory as well for your clinical setup, for those who have a complaint or a farce in their mind that the patients don't accept the consent, the patient won't sign. There are so many clinics in India who are following consent since many years. I repeatedly use the word so and many in a double tone, but what I mean to say that they're doing since years and they're flourishing. And I gave the example of Karnataka State Dental Council in my that MLE video of 2 hours. So what I believe that it is one of the most enterprising dental council in the say country, and it basically came up with an advisory in the first week of September that all patients are required or requested to sign the consent form as per their uh, as per their dentist advice. So tell them your patient the schedule, the working time, and your way of working, especially the patient system. This should cover and convey how and when at which stage you want to receive how much amount of money. As I said, when the total bill is 50,000 or 1 lakh rupees, the patient is not interested how much he is paying. And you are going to make sure that you are charging whatever you charge for a procedure. If you are doing that whole procedure, you are charging 10 to 15% more at each step, so that you are done by 6th, 7th, or 8th sitting out of 10 for with the total payment part. You have to understand this thing. The payment collection is in your hand. You have to formulate the treatment plan. But again, if you are having 20 patients in the day, 15 patients in the day, and you are working like a dog or like a horse, sorry, you're working like a donkey or a horse, you will not even find the time to do that, because for doing that, you will have to encroach upon your family time. So learn to filter out your patients via 80-20 principle. Learn to identify those 20% who are going to give you 80%. This is going to be the new norm in future. Of course, I will not have any difficulties in doing that because I am already following that. So if those who don't understand, they have to be told that the process is like a car, and you are the front tires and the patient is the back tires. And all fields, if they run in sync, all four of them run together in sync, then only you can say run the car smoothly. Otherwise, you will not be able to drag it along alone. Inform the patient that if he expects honesty, he'll also have to follow the same with you. As I said, my work begins whenever I always say, whenever we are on the same page. And if we are not on the same page, I don't start the treatment at all. So that is my way of working. So it'll be say acceptable to some, unacceptable to some. So it does not make any difference to me. I will advocate that only say uh, which gives me success. I'll follow that template only. So do the good work for chief complaint, but as a duty, as I said, inform and educate. IND जरूर कीजिए, because otherwise never push the patient for the same treatment. Let him be pulled back towards you. As I said, treat the chief complaint with the 3 E's, and let him be pulled towards you for the same, as that would tell you the patient's satisfaction potential towards you. So many times, as I said, patient asks us also before sitting on the chair, बेटा बता तो दो कितने लगेंगे पैसे ट्रीटमेंट. कोई बात नहीं, आप बैठो बैठो बैठो, कर लेंगे एंड में कर लेंगे. तो जब हम when we work with such an approach in life, that is the only problem, that we never conveyed the rules to the patient, the rules of our game. This is our arena. We are playing the game, and if we don't convey the rules of the game, not in a literal sense, I mean to say the game, but if we are not conveying the rules of the game to the patient, how will they assume and presume? We sometimes do only a sweet talk, and when we have payment woes in the end, we always say that the patient was wrong. I would say, no, I'm sorry, you were wrong, or we were wrong in that before starting the treatment. So the primary thing always is knowing yourself, your abilities, your skills, knowing your patient, the target audience, and the point from where we started, the needs and the wants. You have to understand this part. This part will be explored more in future. You'll have to spend more time on your consultation. You'll have uh, to assess more on your patient, so that you know what his psyche is, what his say paying capacity is, what his needs are. And believe me, we as health professionals might be slightly say uh, less conscious about our health, but a layman does not. Whenever anyone searches over the net, he searches for the best endodontist. He never searches for the cheapest root canal specialist. So he might be wanting those at the cheapest price, but he searches never for the worst. He searches always for the best. So be the best in whatever you can. So people ask me, मैंने कैंप लगाया सर, पेशेंट उसमें से आते नहीं है. I always advise, don't do camps for conversion part. Anyways, camps have less than 1% conversion rate. Do it as a part of your CSR, your corporate social responsibility. So always think that it is like a, say, aim, or say way and mean to increase your visibility and remembrance in patients' minds. So when you talk of the conversion ratio, an ideally acceptable conversion ratio is 7.2 over 10, or say 72 out of 100. So that means if you say consult 100 patients, if 72 of them are getting treatment done, you are doing really good. You're really doing, say, exceptional. Any minimum ratio acceptable is, say, uh, around 5.5 to 6. Below 4, it is counted as poor. So just again, how will you know this? From your record keeping. If you're not doing it only, remember, you have to, say, make changes to your practice, indulge in record keeping. Anyways, record keeping is mandatory as per the revised dental council regulations, and those records have to be maintained for a period of 3 years from the treatment finishing part. So you cannot ignore that also. It is a mandatory as per law also. I mentioned in that medical legal presentation as well. So why do you need to detail, if you, why do you need to reduce your prices, if or resort to bargaining, if you have detailed first? You have to start on an even background. Never eat into your profits. And if you say do bargaining to one, it'll spread the word that you are prone to it. So I always believe, being a banker son, I always say, know your cost, know your figures and numbers. Don't believe in the hatti chatti vatti theory. This is theory very much prevalent in Punjab, or in, say, northern India, which means that firstly you will eat from your own pocket, keeping very low prices. Then your OPD numbers increase. Then you will break even, and ultimately, when your practice grows, you can increase the charges, and you will carry home something. This was a philosophy followed in 1840s in coal industry. How this economic theory of coal industry came into dentistry, it is really beyond me. So, a famous quote by our Punjab MLA come ex-cricketer Navjot Sidhu: "Statistics are like mini skirts; they reveal more than what they hide." So, always be, as a banker's son, I am always, say, fond of numbers and figures. So, I always was. I wanted to do non-medical only. I was pushed into this profession, but then, of course, life has its own plans. I don't regret even till today if I am a dentist. Even if I have to be reborn again, and which profession to choose, I'll happily choose dentistry, because I know the power of this profession. I've seen this profession to be growing. I know the true potential of this profession. I've seen it that even if we don't earn anything much for 24 days of a month, earning a X amount, let's suppose 1 lakh rupees is our average amount. So our profession has the power to give us 3 lakh, up to 3x of that amount in the remaining 6 7 days of the month. Such is the power of dentistry. And I really do not say have any doubts that I'll be dentist again. So what are the basic rules of pricing? I always say that any pricing should cover your basically all costs and profits. The You can't actually lower your costs always, but you can definitely control the input part. And if you say control your input in that sense, you can definitely control your pricing. So if you're starting again, as I mentioned, one of my articles which will be online in a couple of days from today is great depth, is on pricing also. And this aspect has been taken care of in another one also, regarding the newbies who are, say, were in queue to open up the clinic, or say searching for place to open up the clinic. This will be taking up into that part. So the me time and the new clinic and the practice, say, pricing and charging, please do go through all these articles. It's taken a lot of effort from my part. I hope you enjoy all these, reading all of them. So if you are keeping going by the hatti chatti vatti theory, as I mentioned earlier, if you stoop to those worldly pressures of your, say, even elders in your family, by, say, keeping your prices ultra low, I'm sure you might not be, say, killing competition, but you can surely kill yourself with such approach. For newcomers, I always say the first rule is to add profit in your calculation of cost. Treat profit as a fixed cost, like a loan prepayment or a EMI. And remember, you have to not recover your cost, but your value also, the skill and the worth. So remember, cost is the service, the amount you spend to produce it. Price is the financial reward, and value is what the patient believes you are giving it to him. So good, cheap, and fast. You can pick any two at one given point of time. You can't pick all three of them together. Only two out of those three at one time. So we all know, but I'll still like to ask, what is the biggest and the most common mistake we do in pricing? And one of those aspect is the underpricing. We still get mistaken in that idea that startup clinics are supposed to win by having the lowest price. That is the where the problem lies. And if somebody gives you 100 kg fruit at say 10 rupees per kg, but it is a 5 day old, would somebody buy it? No, because we are concerned about our health first. Even at one tenth the price, we are not going to buy that fruit. If price was the criteria, why did Tata Nano fail? Tata is the say top five brands of India, and its cars are very good. And as per the study, we know Tata uses Jaguar parts in its cars. So why was Tata Nano unsuccessful? Why did not unsuccessful? It failed really badly, and it failed badly. So that is the reason that people thought that they in 1,20,000 they can't use Jaguar parts, so they might be giving something adulterated in that. So the same answer has to go for that also. Price is not the only criteria people choose while choosing a dentist. Remember this part: nobody would like to go to a cheap heart surgeon, nobody would like to go to a cheap dentist, nobody will search for a cheap endodontist, although they will desire a price. But yes, that is where the law comes in. The medical legal part always say convey the charges beforehand. The main dispute arises only when we, in a say zeal to do more, sometimes don't convey the charges first hand. And after the treatment, if the patient is sometimes taken up by surprise, some of them pay silently and leave, and we never see their faces again. So they feel that they were cheated because they were not told earlier, and they were basically looted, rather. I'll use the very crude word. So some of us might have seen that even after quoting the lowest price, sometimes the patient will not or does not get converted for treatment. Have you ever wondered why? The primary reason for that is patients think that maybe, like a Tata Nano example, maybe he's using something adulterated. So everything is inflationary. So I won't risk my health with him. So where will the next buck come from? I always say, don't be insecure, don't be insecure. Why? Even your neighboring dentist does not have a FD of patients that he will go to the bank and break his FD and get new patients. His booking might be 1 or 2 weeks more than you. That's it. Even in his case, he's not sure where is the next buck going to come from. So we have to remember this part. Again, pricing mistakes are say hugely in number. I've taken up those in my detail in my article. Kindly do go through it whenever it is online. So for this, I have written a quote as well: insecurity stems from the infertile mind. Make your minds healthy and fertile. So there will be always someone who will charge less. You should have no debate over your competitors who charge less. They know what your or what their worth is. If your worth is if your worth is this, don't charge for this. If your worth is this, don't charge for this. It is as simple as for me. So, how many of us actually say strongly think to raise our charges annually? Very few. Say we live in a false paradise and believe that if the patients are happy with charges, we if we charge more, they're going to go say or leave us and search for avenues outside our clinic. So that is where we are wrong. So in these testing times, Corona has say provided us with a very great advantage of increasing our charges. Not, I'll say mid-year, almost mid-year only, when we'll be starting properly. It'll be close to mid-year, if not properly mid-year. So we have an option to increase our charges. For those also who increased in January, And for those who have been working on the same charges for the 5 years, all of us have a good chance to raise our charges to cover our profits and margins of past and the enhanced cost in future. Remember, our costing, how much is it is going to cost, will be clear in the coming few weeks, not days, in the coming few weeks. I always believe life is full of surprises. Who knows what surprises are in, say, in stored in a ruck. Nobody ever predicted that all the world will come to a standstill like this. Did we even imagine, even in the wildest of our dreams? Or even if we did, for this long, for this many days, at the cost of something similar, uh, if it is not World War III, what else is going on? So life is full of surprises. So we have to realize that we the patient does not choose us only because of our charges. Patient choose us because we offer them good service, ऐसे भी and वैसे भी. I always say ऐसे भी and वैसे भी because ऐसे means treatment wise, वैसे भी means our overall package, our behavior, our ambience, our say internal marketing, our way of dealing with the patient, our way of attending to the patient, and add to those trivial factors I mentioned before: the waiting time, your say decor of the clinic, your say record keeping part, your immaculate detailing, your treatment plan, your clarity about your job, your say ability to finish the task in say estimated time, your ability to finish the say costing part in the given estimate of time. So remember, all these things play a role. So never wait to educate in your practice, because always we sometimes classify a certain category of patients as brain eater patients, that these are not going to give us any revenue. Believe me, sometimes they turn out to be good paymasters. It is always good for the patient to be aware. Ultimately, you are going to work on his body, on his teeth. Remember this part. So whosoever has to pay money, he has full right to undergo say all the kind of options he wants for that. So earlier there used to be second opinion. I always say that कोई भी आपके पास patient आए, मान के चलिए that he is your third opinion. You are his third opinion. The number one opinion is his original dentist. The number two, Dr. Google, and say number three, you are. So always do an honest consultation, uh, telling out your treatment planning in that, without bad mouthing your colleagues or without undermining their diagnosis, whatever they done. So who knows? I have turned say primary dentist of so many patients. Even when I was their third or the fourth opinion. So as I say, life is always full of surprises. So whatever you do, you have to do your best, and for that you have to be in love, and you have to be in love with your profession, in love with your dentistry first of all. So always remember, you have to charge your worth, follow the principle of 80/20 very strictly. As I said, don't take a false pride in the OPD of 50, and start filtering out your non-target group OPD. Always understand what is your target audience. So promise only what you can deliver, and then deliver more than what you can promise. So under promise and over delivery should be the mantra of every practice. So why patient satisfaction should score as a top-notch priority? Because if you satisfy one, it reaches four new patients, and if you disappoint one, it reaches 10 potential patients. I always believe that a satisfied patient is a great practice builder. Remember, I gave that example of 10 to 20 to 50 to 100 to 1000. So they are the ones who are the building blocks, like proteins of our body, the proteins which are the building blocks. So similarly, a satisfied patient is a building block for our practice. So, a few tips before I say take up the final climax part. So, keep the count of money, count of the number of the patients, not the money. Your goal is not earning money. Your goal is treating the patients happily and successfully. Remember those figures of 10 to 1000 as I mentioned. Once you reach your 1000 figure, money will become a byproduct. Your pension will automatically start, provided again there is a if, provided or because, provided you don't change your work ethics, that'll surely be there. So if your money is important, then patients money is also important. So dream of the number of patients and type of the treatment you can offer to them, not always think about the money part. Sometimes you have done two NRI patients in the month, and you have earned more than the average, but you have not paid attention to the other patients in the month. So remember, the NRI, they're not going to stay forever. You will always have what the patient needs. As I said, in the coming times, the wants will decrease, but the needs are never going to. We might have say by not we don't have any option. We might have to limit our eating out. We might have to limit our vacations. We might have to limit our movie going experience. But we are not going to skip our dal, roti, and chawal. We are still using that even in those cases of lockdown. Our milk, our protein, our cheese, these things are going to there. So needs will also always be there. It is only the wants which are going to diminish. So I always say if any asset becomes your liability, it is better to get rid of them soon. So this was a quote again written by me in 2016, and I have applied it practically also in my life. So I always insist on application of this. Okay, now I come to the climax part, the most interesting part, the carry home gyan for today in the coming slides. So what you do, what you need to really do ASAP in your clinic. ASAP means immediately, as soon as possible.